Alright, so we have some samples that are going to be sent out to our Antech lab. We have some blood samples and a biopsy sample to be sent out. Each of them are labeled correctly with the patient's name and date, and the paperwork is according. The biopsy sample is double bagged and has the appropriate paperwork. We're going to set them inside of the box that Antech picks up from. It is insulated and has 2 ice packs in the bottom to keep them cold. We're going to lay them in there, close up the box, and lock it. And then this box is going to be set on our door for the lab to pick up. Alright, so I'm going to go ahead and show how to do a cleaning on our Heska chemistry machine. So the first thing we want to do is we want to go ahead and we want to shut it down. We never want to do the cleaning while the machine is running because it can damage the parts inside. Alright, so now that we've powered down the machine, we're going to go ahead and open up the cover and we're going to start cleaning. We want to start on this side and work our way there. So what we want to do is we just kind of want to wipe out all the internal devices with a chem wipe because we don't want to scratch any devices. We're just trying to get all of the dust and debris out of it. Alright, now that we've wiped out all the dust and debris, we want to go ahead and take this plate off. We unscrew the screws, lift up the plate, and pull it forward. Once you pulled it forward, we want to go ahead and place it upside down so that the underside does not get scratched. Then from there, we can take another chem wipe and we can pull out these pieces here and just wipe them off. Make sure that there's no dust and debris inside any of these small crevices. Once we wipe them off, we can put them back. Once we've done that, we can go ahead and take the plate, take another chem wipe, and just give it a nice wipe across the top. Remove any dirt and debris that is collected underneath there. Once that is done, we can go ahead and replace this plate. Want to slide it back under. Place the screws back in place and screw them down. Once that is done, we can go ahead and take this faceplate off, and then we'll start with our incubator. Again, we want to wipe all the dust and debris away. We don't want to open that up and introduce dust into that environment. So the more dust you can wipe away, the better. You can use a little bit of saline if there are some gunky spots, like right there. Alright, now that that is clean, I can go ahead and detach the power to the incubator. I can lift off the cover plate, set it aside. Then I'm going to want to undo all of these screws. Can be a tedious process undoing all the screws. Alright, want to make sure that all the screws are loose. Then we can go ahead and pull up the incubator. Now we never want to touch any of the devices under here with our bare hands, so we're going to go ahead and take a chem wipe and we're just going to wipe off each one of these, never touching it with our bare hands. Wipe the center out. Once you've done that, you can go ahead and set it down, making sure to keep it bottom side up. So what we're going to want to do is we're going to want to undo these screws here. This is the scanner that reads the barcodes on our plates that have the tests on them. Then we're going to want to make sure that those are all loose. I'm going to lift this up, right side up. Here's the scanner. To clean these, we want to use a little bit of saline on some cotton tip applicators, just a little bit. And then we're going to gently wipe the inside of these. Alright, now that those are dry, take a chem wipe and just gently pat the inside of them to get rid of any moisture that's in there. And I'm going to replace the piece. Making sure the screws are set in their correct places. Alright, it's tight. Once that's done, we're going to go ahead and take a chem wipe and just do a quick wipe over to grab any hair, dust, and debris that is collected in here. Alright, now we can go ahead and replace the top. Again, never touching the bottom side. Flip it back upside down. There is an arrow here that matches up with the arrow there. We're going to go ahead and gently replace that until it clicks into place. Once it has done that, we're going to go ahead and screw down our screws. Alright, once those are all in place, we're going to go ahead and replace the cover, making sure that the little cutout there matches up with over here. Going to reconnect our power. Alright, sliding that into place. Then we can go ahead and replace that, and then you're all done. General maintenance and cleaning have been done. Alright, so we're going to be doing a ELISA snap test. I have my sample that has been sitting here and now has clotted. What we're going to do is we're going to go ahead and put it in the centrifuge and spin it down because this test requires serum. When we put it in there, I'm going to go ahead and warm the test because the test has to be room temperature. Alright, so now that our sample has spun down, we have serum. The test has warmed to room temperature. So we're going to go ahead and open up the test. Now that the test is out, we want to go ahead and mix our conjugate and our sample. So what we're going to do is we're going to take 3 drops with a pipette, 3 drops of sample, 1, 2, 3, and then with another pipe, or has a little lid, we're going to put 4 drops of conjugate. Alright, lid back on. We want to invert our sample 3 to 4 times. We're going to go ahead and dump our mixture into the well, and then we're going to wait for the conjugate and sample combination to go all the way up to the top, and then we're going to wait for it to come into this little hole. Once we see that it has come into the little hole, we're going to press down on the snap tests, and that'll begin the test. The test has to run for 8 minutes to get full results. So now that we see it's coming up top, push down and snap the test. Alright, so I have Bailey here. She's here for an ear cytology today. I have all the materials that I need. I have my exam gloves, I have sterile cotton tipped applicators, I have my slides, and I have sterile saline that I'm going to draw up in a syringe to moisten the tips of the cotton applicators. I'm going to go ahead and put on my exam gloves. Alright, now that I have my exam gloves on, I'm going to go ahead and open up my sterile applicators. And I'm going to draw up my sterile saline. Okay. I'm going to go ahead and take the needle off, pick out a few, and just moisten the tips of them. All right, now that those are moist, put it back on. I want to make sure that I have my slide ready available. I'm going to take the cotton tipped applicator. I'm going to go ahead and open up Bailey's ear so we can see inside there. I'm going to go ahead and insert the cotton tipped applicator inside her ear, making sure not to go down too deep so I don't damage her eardrum. And I'm just going to use a circular motion technique to get my sample. All right, now that I have my sample, I'm going to go ahead and take it over to the slide, and I'm going to go use a rolling technique to put the sample onto the slide. All right, so now that I have the sample from Bailey's ears, I'm going to go ahead and prepare it for staining. If she were to have large waxy buildup, I would use a small flame or blow dryer to dissolve the wax. Since she does not have a large amounts of wax and the slide is dry, I'm going to go ahead and prepare it for staining. So I'm going to go ahead and do 10 dips in each. I want to make sure I coat the entire sample with the stain. Alright, so now that I have stained the slide, I'm going to go ahead and bring it over to the sink, flip it over, and run distilled water on the back to remove any excess stain. Once I've done that, I'm going to bring it over to the tray so that it can dry. Alright, so now that Bailey's ear cytology slide has dried, I'm going to go ahead and put it under the microscope for evaluation. I'm going to turn on the microscope. I'm going to do a quick scan on the 4S subjective lens. I'm going to be looking for ear mites. Quick scan here. Alright, so I'm not seeing any ear mites. I'm going to increase my power to the 10x objective lens. What I'll be looking for under here would be bacteria, yeast, you can see epithelial cells. The yeast would show up, they would stain dark purple and look like bowling pins. The bacteria could either be in the rod form or the spherical form. Alright. So the only thing that I am seeing on Bailey's ear cytology would be squamous epithelial cells. I don't see any bacteria or yeast. Alright, so this is Tatiana. We're going to do a necropsy on her. She weighs 19.9 pounds. This is Dr. Cleveland. She's going to be doing the necropsy. She's going to do a quick external examination. She's going to check her over, look for any skin disorders, any marks on her skin, on her limbs. She's going to check inside her mouth. There is a oral mass that we are going to take a biopsy of. So she's going to go ahead and do that right now. I have my biopsy jars ready and properly labeled with her name, today's date, her date of birth, her patient ID, and then I will write the where this sample came from. These jars are filled with formalin. All right, so we have our biopsy from the oral mass.
All right, otherwise she looks pretty healthy from the outside. So we'll just go exploring. We're going to be looking for any other abnormalities possibly associated with the mass.
So Dr. Cleveland's going to go ahead and make her midline incision. We are wearing our protective gear. We're wearing plastic aprons, exam gloves, masks, and goggles.
Sorry guys, we have to get to the skin first.
We did get verbal owner permission to do this necropsy on her.
So I just kind of go through and look at all the major portions of the body cavity here. The hair looks pretty unexciting. The omentum's pretty normal. She's got some adhesions in here, likely just from old age. Some good normal kidneys down here. Very nice. Let's take a look at this reading. Kind of gently examine it here. It's pretty, a little bit small, but pretty normal. There's the stomach. We gotta go through and run the whole gut, look for any abnormal areas. Kind of hard because of all these adhesions we're seeing here. That can be just because she ate things she wasn't supposed to. Hopefully that looks pretty healthy otherwise. Just some age-related changes. What I'm looking for is that liver, so we're gonna have to go up a little higher here. Skin dog. I will not cut you. I promise. This is it. So I'm actually going to look here. Here's our liver. A couple of changes to this liver actually. You can see this little spot here. Be a good sample area. So I'm going to take some of that. Looking real gentle. It's okay. We don't need the bacteria anyways. Alright. Gallbladder looks normal. Alright, so I'm going to puncture the diaphragm, see if we have some negative pressure. Yes, it was good. Okay. Now I need to do some dissecting to get to the ribs, guys. And then we're going to have to break these ribs, so we might have to come back on the camera after that. I think we need to grab that too. Maybe a little dog, my friend.
Alright, so now that we have the chest cavity open, Dr. Cleveland's going to examine the diaphragm and the heart and the lungs.
I'm just looking at the areas I couldn't see of the liver. See, there's a couple other little spots. Anyway, these lungs actually look pretty good. Nice. I'm going to make a little cut to look at the heart here. Make sure no abnormalities. That pericardial sac there. We got the aorta, but that's okay. Pretty normal sized heart actually. Looks really nice. Got some adhesions. Just want to look at the other lung. It's very normal. Very healthy looking. Right.
Alright, that is an examination, necropsy of all the major organs. Now we're going to go ahead and put her back together as best we can and sew her up and send her off for cremation. Alright, I'm going to be talking about rabies in the clinic. So when you do get a rabies suspect in, the people who are allowed to work with that rabies suspect are personnel who are actually vaccinated for rabies. Those personnel must be double gloved, wearing masks and goggles. The personnel who deal with the specimen, the surgeon who removes the head and takes the sample, must also wear Tyvek coveralls along with all those other protective equipment. The specimen must be double bagged, put in a refrigeratable container with ice packs, and then sent to the appropriate laboratory. The rest of the body must be double bagged in red biohazard bags, labeled as rabies and disposed of as a biological hazard. Alright, so we have Bailey here. We're going to do a vaginal cytology on Bailey. So I have all the materials that I need. I have my exam gloves. I have sterile cotton tip applicators. I have slides, and I have sterile saline for flushing and moistening the cotton tip applicators. So I'm going to go ahead and put on my exam gloves. I'm going to drop 5 mils of sterile saline to flush the vulva with. I'm going to take the needle off. I'm going to come over here first so I can have visualization of her vulva and give it a good flush. Alright. Then I'm going to go ahead and open up my sterile tip applicator. Drop some more saline. Take off the needle and moisten the tips of these applicators. Alright, now that I've done that, I'm going to go ahead and take an applicator, come back over to the vulva, and I'm going to insert the cotton tip applicator into her vulva and then into her vagina. So the way I want to do that is I want to insert vertically at first, and then horizontally into her vulva. Alright, I'm going to go ahead and rotate the cotton tip applicator using a technique to pick up the sample. Then I'm going to go ahead and pull it out, take my sample over to a slide, and roll the sample onto the slide. This is the proper technique used for vaginal cytology. Alright, so now that we have the sample taken from Bailey's vaginal cytology, it is all dry now. I'm going to go ahead and bring it over to be stained. I'm going to go ahead and insert it into the stain. I'm going to do 10 each. Making sure to coat the entire sample area with the stain. Alright, then I'm going to over to the sink. I'm going to turn my slide over, take some distilled water, and put it on the back of the slide, rinsing off any extra stain. After that is done, I'm going to bring the slide over to the stand and let it dry. Alright, so Bailey's vaginal cytology slide is now dry. We're going to go ahead and take a look at it underneath the microscope. I'm going to go ahead and look at it with the 10x objective lens. And focus, do a scan. What we're looking for here is what type of epithelial cells we're seeing. Alright, so Bailey's slide has large intermediate cells and some neutrophils, which indicates that she is an anestrus. Other types of cells that you would see indicate different stages of estrus that a dog could be in. They're in anestrus, you see the intermediate cells all with some neutrophils, and you can see also parabasal cells. The next step is proestrus, where you could also see intermediate cells along with a small amount of neutrophils. And the next step is estrus, where you now see squamous epithelial cells that are anuclear, so they do not have any nucleus. And then you're going to see a small number of red blood cells. The next step is diestrus, where you're going to see non-cornified squamous cells and other debris from the cytology. Alright, so we're going to be doing a cross-matching procedure on 2 dogs. So we have both the donor's blood and the recipient's blood. Both the tubes have been properly labeled, also with donors, so they are not confused. There is an EDTA and serum separated tube, as we need both serum and plasma. So what we're going to do is we're going to go ahead and open up our centrifuge, and they have been sitting for 10 minutes and have clotted. So we're going to go ahead and put them inside our centrifuge and centrifuge each of them for 10 minutes to get the serum and plasma off of them. Alright, so now that the centrifuge has spun down both the serum and the plasma, both tubes, we're going to go ahead and pull the serum and plasma off of both donor and recipient. The serum is going to go ahead and go into our red top tubes, and we're going to decant the plasma into our non-additive tubes. So I'm going to gently pull up the plasma, not to disturb the sediment. I'm going to take a pipette, make sure that my other tube is ready, making sure that it's sticking with the correct labels. To pull this off, and I'm going to remove the plasma from the sample. All right. So there is the donors. And I'm making sure to use a different pipette every time. Right. Now I can go ahead and pull out the serum tubes. Since they have a serum separator in there, you don't have to be as gentle with pulling them out of the centrifuge. Alright, now we have our plasma and our serum drawn off in 2 separate tubes. Alright, so now we're going to go ahead and start with the washing process. I have my EDTA with plasma removed, so what I'm going to go ahead and do is I'm going to put 2 drops of each sample into their respective tubes for centrifuging. So I have pipettes. I'm going to go ahead and pipette off 2 drops. Alright, then I'm going to go ahead and fill the rest of the tubes with 0.9% sodium chloride, so saline. Then I'm going to go ahead and recamp these, and I want to make sure that I invert them and mix them up. And we're going to come over to our centrifuge, and we're going to centrifuge each of these samples at 3,400 RPMs for 1 minute. Alright, so now that our samples have spun down at 3,400 RPM, we're going to go ahead and take them out. And what we're going to want to do is we're going to want to decant the supernatant that's on them, and then refill them with saline and centrifuge them again at 3,400 RPMs for 1 minute. We're going to want to do this until the supernatant is near colorless. Making sure to keep our sample. Again, inverting them gently to mix them, sticking them back in our centrifuge at 3,400 RPM, and spinning them again for 1 more minute. Alright, so now that the sample has been spun down 2 and 3 times, the supernatant is clear, which is what we're looking for. So what we're going to do now is we're going to go ahead and pipette off the supernatant so we can get the packed erythrocytes. Alright, so now the supernatant has been pipetted off. We want to draw up 0.02 mils of these packed washed erythrocytes. So I'm going to go ahead and use a 1 cc syringe. I'm going to draw off the sample that I need. To make sure that I have 0.02 mils, so that is exactly 0.02 mils. So what I'm going to go ahead and do is I'm going to take this sample, making sure I have the correct tube, and I'm going to go ahead and put it in the new tube labeled donor. and I want to now fill it with 0.98 mils of 0.9 sodium chloride. This is going to make our suspension. Okay. Now that I have done that, I'm going to do the same exact thing for the recipient's sample. Alright, so now we're going to do the testing portion. I have over here set up the major tube. We're going to do the major cross-match first. So to do that, we're going to take 2 drops of the recipient's serum and 2 drops of the donor erythrocyte suspension and put it in the separate tube. So I'm going to use a pipette, draw off some of the serum. 1, 2. Making sure to use separate pipettes. Alright. Then we just want to mix gently. Alright, and there is the major cross-match prepared. Now we're going to go ahead and do the minor cross-match. So the minor cross-match uses the donor serum and then the recipient's erythrocyte suspension. So we're going to go ahead and draw these off using 2 drops of each. We're going to recap this and mix gently. Okay. Now we're going to go ahead and do the controls. The way we want to do that is I've taken 2 extra tubes, wrote control recipient and control donor on them. How we're going to do that is we're going to go ahead and take 2 drops of the donor suspension and 2 drops of the donor serum and mix them in the control tube labeled donor. Mix that gently. Okay. We're going to go ahead and do the same process for the recipient. 2 drops of the recipient's erythrocyte suspension and 2 drops of the recipient's serum. We're going to mix that gently. Now we have our controls for the donor and the recipient set up. Alright, so now we have our tubes in a rack. We have our major and minor cross matches along with our donor control and our recipient control. We're just going to go ahead and mix each of them gently. And then we're going to let them sit at room temperature to incubate for 30 minutes. Alright, so now that we've had our tubes sitting out at room temperature for 30 minutes incubating, we're going to go ahead and put them inside the centrifuge. We want to centrifuge these tubes for 1 minute at 3,400 RPM. Close to make sure we're at the right RPM and set it for 1 minute. Alright, so now that we've had our tube centrifuged at 3,400 RPM for 1 minute, we're going to go ahead and take them out and examine them. Okay. So we want to go ahead and look at them with our eyes. So if we look at this, these are the controls. So the controls should have no hemolysis, which I'm not seeing any hemolysis in there. In either control. We want to go ahead and tap them real quick. Just kind of gently stir them up. and we can see that there is still no hemolysis. Okay. Then moving on to the cross matches, we want to go ahead and tap those as well and look at them. So in the cross matches, there is some mild hemolysis, and it looks like there is agglutination. I am seeing visible agglutination in the minor cross match. Hemolysis in the major cross match as well as visible agglutination. So since there is visible agglutination in the cross matching, that means that these two patients are not a match for transfusion, and a new donor should be chosen. If there were no no agglutination visible, we want to take a look at that under the microscope. So what we would do is we would just take a drop from each, put it on a slide, and look at them under a low power. We want to make sure that the if there is still no agglutination present, you will see that the erythrocytes are evenly spread out, and you don't want to confuse relay for agglutination. Alright, so I have Bailey here. She's here today for a skin scraping. I have all my materials that I need: exam gloves, slides, a size 10 blade, and mineral oil. I have already shaved a spot on Bailey where I'm going to be taking my sample from. So I'm going to go ahead and put on my exam gloves. Now I'm going to go ahead and put a drop of mineral oil on my slide. Then I'm going to take my size 10 blade and open it up. When holding the blade, you want to make sure you hold it in between your thumb and forefinger for safety. Then I'm going to go ahead and dab a little bit of the mineral oil on the tip of the blade. I'm going to come over to Bailey, and the way I'm going to scrape is you want to hold it perpendicular to the skin, just in case you don't want to make an accidental incision. So what we're going to do is we're just going to scrape. You want to scrape down until you get capillary blood. The reason you want to scrape this deep is because mites live deep within the hair follicles. Now we've got some blood. I'm going to go ahead and take my sample, bring it over to the slide, and just dab it in the mineral oil. I want to make sure I get all that sample off. Alright, that's it. Alright, so now that we have our sample from the skin scraping, we're going to go ahead and prepare it for microscopic evaluation. All you need to do to prepare it is you want to take a cover slip and just place that cover slip on top of the sample. Make sure you have just one, and then place it on top of the sample. Alright, so now that we have the cover slip on our slide, it is ready to be looked at. We're going to go ahead and turn on our microscope. We're going to put your slide up on the microscope. You want to look at the slide under the 4x scanning objective lens. So I'm going to go ahead and take a look, scan through it real quick. I want to use my focusing knobs to make sure that I get a full view. Alright, so on her skin scraping finding, I'm seeing a lot of yeast. Other things we could see would be, we would be looking for Demodex mites, sarcoptic mange. We would also see, since it is a skin scraping, we would see epithelial cells and red blood cells.